David came back last night and it felt like he had been gone for a year. The first thing I told him was, I was so bored without you. I told him about this experience I had while he was gone where, I had a physical a few weeks ago and I needed to book an appointment to get my labs done, to get blood work. I asked at the doctor's office, how much do you think it's gonna cost? Just give me an estimate. They're like, oh, we can't give you that estimate, but you can get on the phone with your insurance, Oscar, and they'll give you the estimate. It's like, great, get on the phone with Oscar. They tell me, we need the CPT codes to be able to give you an estimate. You need to call your physician. Call my physician. They're like, oh, we don't have the CPT codes. You're gonna need to call Quest, the lab, where they're gonna do your blood work. Quest has a whole automated system. They will not let you talk to anybody. This is an automated person. Are you looking for CPT codes? We don't have them. You'll need to ask your physician. Call my physician. Nothing's wrong with me. This is just like your regular physical. I'm left with like, well, I'm not gonna do the blood work. I'm not gonna spend thousands of dollars to check my iron levels when I'm feeling fine. I love LA. There's a lot I love about America, but it doesn't feel possible to live here. Like, it feels inhumane. The thing that really gets me is that most of the people who are making decisions about healthcare will never know what it's like to not have it. If they don't face the daily realities of what it's like to deal with the lack of options around healthcare in the US when you don't have a company paying for it, there's no way they can understand the frustrations. I was thinking the other day, like, when David and I want to get pregnant, when we want to have kids, we're gonna have to try and get pregnant in like January or February so that we can have all of my doctor's appointments and the birth in one calendar year so that it can all be under one deductible, right? So that with all the doctor's visits and the birth, we'll definitely meet our deductible, which is $8,000, which means that all the healthcare around pregnancy and birth will cost no more than $8,000. If we were to get pregnant in, let's say, June, we have to pay for all my doctor's visits. Then I give birth in the next calendar year. It definitely costs in the US more than $8,000 to give birth in a hospital, which is not even what I want. I would love to give birth in a birth center with a midwife, but I don't think that's possible either with public health care. It's actually infuriating. And I think a lot of people in America have no clue. If you are working for a company that has benefits, you have no clue what it feels like. It's a whole other conversation then. Like, I feel like a lot of people stay in jobs that have benefits simply because it's almost impossible to live in America without a job that has benefits. It's like you're trapped. You're trapped in like this corporate system. If you want to do anything that's outside of that, if you want to be an entrepreneur, be an artist, work freelance, if you want to do anything that is not working for a corporation, you're screwed. There's no point to this video. I want to live here forever. I want to live in this neighborhood, in this community forever. And it doesn't feel like I have that option. I either have to get real rich so that I can afford to take care of basic needs, or I have to be okay with facing bankruptcy at any moment because of a few hospital bills. Anyway, we're moving to England. I'm just kidding. It's too cold. That rant was over a month ago, but it still stands for me. I should clarify that we do not live outside of the system. We pay several $100s a month for our healthcare. What does it get us? Next to nothing, but I'll spare you the boring details of our insurance plan. There is one question that has still been rattling around in my brain though. I've been wondering, like, what will become of a society that punishes its creative members? And any members who do meaningful, vital work that does not fit within the confines of what a relative few have decided is productive and deserves benefits. It's not good, I'll tell you that.